Welcome back to the Community of Innovation podcast, brought to you by the Center for Aging and Brain Health Innovation, otherwise known as CABHI. I'm Allison Sekuler, President and Chief Scientist at CABHI and the Baycrest Academy for Research and Education.
And I'm Rosanne, Aleong, Executive Director of Research, Innovation, and Translation at the Baycrest Academy and Director of Research, Innovation, and Translation at CABHI. Over the coming weeks and months, we'll be doing a series of special bonus episodes from our 2023 CABHI Summit. For today's episode, we're featuring a panel of global experts exploring worldwide disruptions in brain health and innovations, specifically looking at the Netherlands, Denmark, Japan, Israel, and Canada. Today's panelists include Keren Etkin, Yasuko Akutsu, Mide Seyi-Ajayi, and moderator Faith Malach. Okay, Allison, we went global now. So what stood out for you?
It was such an interesting panel, and I think it just shows that no matter where you are, no matter where you live in the world, we share a lot. And there are a lot of commonalities, probably more than differences, across individuals, across people living in different parts of the world. And people all want the same kind of thing for their loved ones, for themselves, if they're living with dementia or at risk for dementia. And you might have to implement things in slightly different ways, but at our core, I think it just showed the commonality that we have in humanity and that we have these common goals. And I think that working together, we can just achieve so much more. So what stood out for you?
So many of our panelists spoke about the role technology is going to play in the aging of the future. But I think they make a key distinction in the sense that, yes, technology needs to be integrated. Yes, technology needs to be accessible. But I think they also emphasize that technology is in service of the experience of the person aging, their family, healthcare providers. It's not technology for technology's sake. And I think exactly what you said about bringing people together, I think our panelists also talk about the fact that it takes really a village to support individuals in their aging journey, whether it be an international village is this case, or, different people with different perspectives, different roles, all towards that common goal of choice, autonomy, personhood, and a really deep discussion on quality of life. So that's what stood out for me.
Yeah. And I think just related to that the idea that you need to be talking to all of those different kinds of people when you are an innovator to be able to make sure you get it right from the very start. So let's get it right and let's get to the show.
Hello, and welcome to today's panel at the CABHI Summit 2023. My name is Faith Malach, and I'm the Executive Director for Care, Transformation, and Innovation at Baycrest in Toronto, Canada. Over the past year, I've had the opportunity to learn about some of the unique global perspectives and approaches paving the way towards a better living experience for all of us as we age, exploring different places in the world, all trying to solve the same problems, all advancing the same solutions to transform the aging experience for the better. Whether it's a focus on health promotion or disease prevention that supports us to be our healthy best, or perhaps the most effective treatments discovered through research, maybe the problem is fighting against the stigma associated with aging by introducing new government policy, investing in training and development, or just advancing new models of care. Or maybe it's to identify the direction for the latest technology, housing, or design that enable not just efficiencies and effectiveness, but also a better quality of life for people. And finally, perhaps the problem is simply about ensuring that as we each age, we don't leave our values, our wishes, and our goals behind, but instead are able to maximize our potential and live the best life we can. Today, I am pleased to host a panel of global leaders and experts as we discuss worldwide disruptions in brain health and innovation. Our speakers will share their inspiration, their work, and reflections, specifically referencing experiences from the Netherlands, from Denmark, Japan, Canada, and Israel. So it is my pleasure to welcome our panelists, and I'm going to start off today with Keren. Please introduce yourself, representing Israel.
Thank you so much for this wonderful introduction, Faith, and thank you for inviting me to be on this panel. I'm Keren Etkin. I am a gerontologist by training, and for the past few years, I've been running TheGerontechnologist, which is a media platform that covers the global age-tech ecosystem and offers age-tech education through the age-tech Academy. Previously, I was a part of a number of age-tech startups. I was the first employee at Intuition Robotics and co-founded Seyi-Ajayi. And before that, I worked in community services for older adults, mostly in the nonprofit sector. And if you ask me what is the most pressing issue and what is the biggest problem we currently have, I would say that we must include technology more than we do now in the aging process, mostly to enable aging in place, but broadly to enable older adults to live life to the fullest. Because in this year, in 2023, technology is such an integral part of modern life, and we simply cannot afford to leave our elders behind. And this is also why I'm so passionate about the age-tech ecosystem, and it makes me really happy to see how far we've come, but also we still have many more challenges to solve. So there are lots of opportunities out there.
Wonderful. Welcome. Yasuko.
Thank you very much. I'm Yasuko Akutsu from Tokyo, and I'm running health design firm. So especially designing medical equipment and medical services. And besides my business, I'm an associate professor of Chiba University Hospital, and I'm produce the reskilling program of medical innovation human resources. I'm Aging 2.0 ambassador of Tokyo. Everyone knows Japan is a super aging society, a top runner. So we are faced on the aging problems and especially shortage of the care human resources. So technology must be essential for us, but it is difficult implementation of the technology because Japanese people is the care by a human is the best. So we must change our mindset. That's a big issue for us.
Excellent. Thank you and welcome. And finally, Mide.
Thank you very much, Faith. My name is Mide Seyi-Ajayi. I'm the Executive Director for Long-Term Care at the Apotex Jewish Home for the Aged here at Baycrest in Ontario, Canada. My background is in nursing. I'm a registered nurse by background. I've been in healthcare for about 14 years, exclusively working with seniors for the last 9 years or so. And I think in terms of the Jewish Home for the Aged, we are a 472-bed home. So one of the largest homes in the country, actually, at the moment, when you think about the square footage and the number of beds. We have residents here that live about 2 times longer than the Ontario average, but also considering that a lot of our residents have more complex issues based on the case mix index. Now, this dovetails a bit more into what inspires, what's my inspiration or the main issues that we're faced with right now in long-term care. One of them that I think everyone else around the world globally faces the same issue is the pressures of the aging population. You know, what are the care centers or the settings that we can actually provide the best level of care for them? In addition to that, we're all faced with health human resources issues. We don't have enough people to actually be able to provide the care. And I think to one of Keren's points, which leads to integration of technology, I think this is something that we definitely have to get more comfortable with and finding better ways to be able to integrate technology into the day-to-day. And then lastly, in terms of the main issues that we're faced with right now, I think it's moving to a position where we are not task-focused or task-based in how we do or provide care, more to being able to actually do with our seniors, as opposed to just doing for them, bringing more value into their day-to-day lives. I think is one of the main things is we need to change the way we provide care.
Fantastic. So we've heard about a range of issues, whether it's use and implementation of technology, whether it's moving away from more of a task-based care model to one that values the living experience. We've talked about how to really enable people to live life to the fullest. And so what I'd like to do is move us to the first question. What inspired your pursuit? We've talked about some of the problems, but What was your solution? Was it a market solution? Was it research? Was it a global study? Was it around a transformational approach that you're using? Perhaps you can each tell us a little bit about what you're doing and answer that first question for us, and we'll just take turns. Mide, why don't we start with you?
Absolutely. Thank you very much. I think in terms of inspiration, I'm sure as with the rest of the panelists today, we can spend quite a bit of time talking about what inspires us. The first thing I think for me really is looking at quality of life for our seniors. When I say quality of life from different perspectives, a personal perspective, I can speak to what I see as quality of life. But then we also have the avenues where from resident engagement or resident feedback, we are hearing from them. What are they seeing as the issues with quality of life? We're hearing from family members and caregivers. And most importantly, we're also hearing from our staff. So we're having staff engagement feedback, and a lot of that gives us a bit more insight into some of the issues that we're faced with quality of life in terms of any kind of a congregate living setting we have here in Canada at the moment. Aside from that, I'm sure everyone realized that we went through a global pandemic. We're still sort of in the midst of one. And that really amplified a lot of the issues that we've known existed for quite a number of years, which is there is a huge impact of loneliness and not having purpose in a lot of our seniors. Now, when I say amplified, again, these issues are not new, but unfortunately, some of the isolation requirements and the restrictions that were put in place during the pandemic really further shed light on these issues. And I think it just really brings everybody on the same page in terms of there's an issue that we all have to work together to find a resolution for. And I think this is not something that will be fixed in a day or two. It's not something that will be fixed in 5 years. It's an ongoing journey. When we think about from a global context, particularly, there are different things that are important to people living in different areas. But I think as we work together, we can learn from each other. And the learning from each other part also gave some inspiration on a recent trip that Faith and I had an opportunity to go on to Denmark and also to the Netherlands. And in Denmark, the inspiration there really was to see a country where there was a concerted effort on the national level to make changes. They refer to everybody in there as citizens. They have very, I think, robust home and community care programs. They focus heavily on rehabilitation. They look at meaningful experiences, whether you're living independently at home or you live in a congregate living setting. So seeing that and seeing how, as a country, they're able to come together and build a system. It's one thing to speak about it, but to be able to build a system, the use of technology, compliance with their ministry, and then also working with innovation and working with some of their youth as well, as we were able to see, encouraging them to get into the healthcare sector. And I think on the other side of it in the Netherlands, we also had an opportunity to visit Diogovic. And that was more or less a change from an organizational level. They created and followed a new model of care using the concept of a dementia village. And, just being able to see those seniors that live there having purpose, having things to do on a day-to-day basis. I still remember observing a gentleman who was picking leaves out of the fountain. The first thing that came to my mind was, oh my gosh, what if he falls in? But speaking to the staff and the team that were there, they said, well, has he had any issues so far? So I think it's shifting our mindset from that protector mindset, again, from the do for to doing with, building capacity. Another one that really struck me, and I think Faith might remember this one, was a gentleman we encountered while we were doing the tour who said, I forgot something. I'm going back home to retrieve what I forgot. Just him saying I'm going back home to his living quarters to retrieve what he got to go about his day goes to show that there's something that has changed. He didn't say I'm going back to my room. He didn't say I'm going back to the unit. He didn't say I'm going back to see the others. He said I'm going back to my home and then going about the rest of his day. I think I'm really looking forward to hear some of my co-panelists today, what their feedback will be on some of that inspiration. So maybe I will be able to actually pick on a few more things to inspire change today. Thank you.
Thank you, Mide. I'm going to now move on to Yasuko. Tell us a little bit about what you're disrupting and what transformational change you're looking to achieve.
Thank you. So, since last year, I have been a research of the implementation of technology, comparing the Japan, Denmark, Canada, and Malaysia. In Japan, we have a lot of technology, but we are not good at evaluation for implement for elder people. I learned a lot from Denmark. Denmark is an excellent technology and networking. They are based on the human-centered research. So they have a lot of evaluation rates for the elder people. But in Japan, we don't have a few research about evaluation for people. We just only for a technology. So it is very different from Denmark. Their data transformation is very good, and they are showing the data, but they based on the human. So how to well-being for elder people and how well-being. In Japan, we don't evaluate the human sources, humans. So just how to technology works.
So do you want to tell us a little bit about some of the study that you're working on?
Yes, I studied about how different each country implement technology to elder people and disability people. So I learned from you, from CABHI. So you developing the technology, you always including users, including senior people, but we don't include the senior people when we developing. Just industry present the technology. They cannot understand the design thinking to how to the aim of the technology, include the citizens, everyone. That's a point of my research.
Excellent, very interesting, and I'm sure we'll hear a little bit more about it later in terms of what you found so far and what progress looks like. But we'll move on now to Keren and welcome you to tell us a little bit about your pursuit of disruption.
Thank you, Faith. So I actually like to think of myself more as an evangelist than a disruptor. So I like to think of myself as an age-tech evangelist. And the reason why I started the Gerontechnologist 5 years ago was because I realized that and when I say we, I mean Intuition Robotics, the startup that I was part of, I realized that we were part of an ecosystem and that there were many wonderful startups out there using the most cutting edge technology to tackle the challenges of aging. And that is what drove me and motivated me to create the first age tech market map. And of course, then I didn't realize it would be the first of many. But after it gained so much traction, it became sort of an annual thing. And I started writing more and more about age tech, not just on the Gerontechnologist, but also on other media platforms and journals. And that's what also drove me to write the book, The Age Tech Revolution, because I realized that if I could do one thing to provide people with bite-sized education about this ecosystem and really allow people to consume a single piece of content, they could consume it over one weekend, that would really bring them up to speed about what this ecosystem is about and why it's so needed and necessary in this day and age, then I was doing my role to promote the ecosystem. And that's also what drove me to start the Age Tech Academy, because we're now able to basically educate many people, not just founders who don't have a background in aging, but want to start something in this space, but also elder care professionals who understand that technology is vital to aging successfully these days, but they don't necessarily know how to approach this. So we get to educate both personas and really push forward this ecosystem and provide as many resources as we possibly can for innovators in this space. And I'm a firm believer in the saying that a rising tide floats all boats. And I think that together with other organizations in this space, especially CABHI, we've seen this ecosystem progress very significantly over the past few years. We see that there are more and more startups that are founded each year. We see that there is much more investment, much more basically venture capital funding going into this space. And I think that if we take a look 5 years into the future, we'll see thousands of age tech startups globally. We'll see multiple unicorns. We'll see more publicly traded companies in this space. And I think we all have a role to play in promoting this ecosystem because it's at its early stages. And I think I'm incredibly proud to see where this is going. And I can't wait to see where this is going also.
It's exciting times. I'd like to go back to Mide for a moment, because I know, Mide, you talked about the inspiration from the Netherlands and Denmark, but I know that you're also doing a little bit of disruption back at home here in Canada and at Baycrest. Do you want to spend a couple minutes talking about that?
Yeah, thank you very much, Faith. So I think to maybe speak a bit more to what Faith is asking about here is Baycrest is known globally for the neuroscience, the research, and the clinical excellence when it comes to seniors care. And this opportunity that presents itself is actually a model of care that Faith and one of our colleagues has put together to develop, called the possibilities model. So what we are actually doing right now is we are working on implementing this care model in long-term care setting. And I think keeping in mind that Ontario, we have a very strict and compliance-heavy sector in long-term care. It's one of those where it's going to take quite a bit of collaboration and creativity for us to be able to implement such a model of care. And what makes this a bit more different, again, I think, is really focus on the neuroscience aspect of it. There's a heavy aspect of the development, and also just the way that we're going to go about the framework, the philosophy, and the tools in terms of implementation, and being able to actually have a team of researchers that can assist with the evaluation. It's very important to be able to evaluate, to understand the impact of such a model of care, and really looking at the relational care aspect of it, because I think a lot of care models out there are very entrenched in person or people-centered care philosophy. But I think we need to move a step ahead of that, which is what is leading us into this relationship or relational centered care approach. And I think we're really looking forward to that journey. It's going to be something where it's more than just a culture change. It's going to be a framework that's going to support the culture change, and with the hopes that it's going to maintain that culture change through the years.
Thank you, Mide. That's wonderful. I think everybody's talking about progress, inclusion, change. So how are you going to measure progress based on each of the individual pursuits that you're taking? How will it have an impact? How will it have an impact perhaps on our sector, or maybe it triggers another form of disruption, or perhaps it changes the lives of people who are aging? Keren, do you have any thoughts on that?
So I'm a number data-driven person. I like to think of the Gerontechnologist and the HTech Academy as data-driven. And I also forgot to mention our academic activity here in Israel. So in 2021, I launched HLab IL with Shankar Design and Engineering Institute here in Israel. And I get to teach young designers and engineers about HTech and aging, and really pump them up and make them excited about creating solutions for this space. So that the basic way to measure is traffic and number of students, right? But that's only on the short term, because in the long term, I would like to see as many of my students as possible launch HTech startups. And if they're not entrepreneurial in mind, then join HTech startups and really push the needle on this space, and really, even if they join a company that makes technology for the general population, be that person in the room who says, hey, did we make this product really suitable for the entire population? Are we including older adults in the design process? Is this really for everyone? And if not, why don't we go back to the research phase and really make sure that we're including older adults in the design process, not just in age tech startups, but in every tech company. So that's how I like to measure things, and that's what I want to see come out of this, and that's the outcome that is my ideal outcome.
It's fantastic. What capabilities do you think our youth, our future leaders, our existing leaders, what do you think they need in order to advance more change for the experience of aging?
That is a great question. I think empathy is the number one skill for anyone who is starting change and is driving change in any area, but especially in the space of aging. And what actually surprised me to see was how passionate these young students were about this space. It never occurred to me that I would find so many people in their 20s who are so excited to take an intro to Gerotech class and are so motivated to then go and pursue internships in age tech startups. And I'm super excited about the future. Because if we have so many young people who are passionate about this space, then basically the top of the funnel for future age tech founders it's a good one, right? We have many young people who are not just actively pursuing it, but also incredibly interested in this space and passionate about this space. And the great thing that I see about this generation is that people really want to make an impact, and they want to use their skills for good. And it's not just about pursuing a career that actually moves the needle and makes an impact. And I think it's very, very not just heartwarming, but really makes me hopeful about the future.
Yasuko, do you want to build on some of Keren's points? Because I know technology and inclusion is critical to you as well.
Yes, last month I visited Tel Aviv, and I'm impressed. Young innovator focus on aging technology. I'm very impressed. In Japan, the discussion has yet to progress for enough to include technology in the lives of individuals, because it is only within the scope in the long-term care insurance system. In Japan, the insurance system is more excellent than another country. So elderly people don't pay out of the pocket for their individuals' technology. But near future, it is difficult to continue the economy because of the increasing the aging population and decreasing the rate of the birth. But now Japanese young people don't notice the market of the elderly now. There are not good technology and good services. If there are many good services, at that time the market will change.
Very interesting. Mide, do you have any comments about technology in your experience in a residential long-term care setting, and perhaps what progress would look like?
Absolutely. I think in an ideal world, I try to be realistic, but I also am a bit of a dreamer. I think in an ideal world, I would like to see a setting where we're looking at adoption of technology from two different aspects. The care provider, and when I say care provider, it could be a family member, it could be a staff, it could be a private companion, and also from the seniors themselves. So I think in a residential care setting like us, what I would like to see, or the hopes that we're trying to get to, is something where you see residents or seniors who are adopting technology like things, voice recognition, Alexas in their room to do things like, reaching out to call for support, or even assisting in documentation of some of what they're able to independently do. For example, if a resident can actually ambulate from the bedside to go into the bathroom to use the bathroom independently, and they can just maybe use voice recognition software to speak to say, walked independently today, no concerns, or maybe knees were a little bit achy, and then that transcribes into their health records that can be reviewed by staff. It sounds futuristic, but I think at this point in time, there are a lot of possibilities that we need to explore. And I think so just adoption from that aspect, and also their social engagement. They are able to call their friends, whether it's through FaceTime or Skype, or any of the technologies that are available right now, whether it's integrated through a smartphone, a tablet, or even their television system, where the resident can actually just, again, voice recognition, or even just being able to use a device to do that connection, so that we're not only looking after their body, but also looking after their mind. And then in terms of the staff or people who are the care providers, it's looking at adoption of technology from the perspective of how can I support or improve the well-being of the senior. Things like being able to bring the care plan or documentation to the point of care. It's not one of those where you do care and then you have to go right to a computer and then try to do the documentation. For example, having like a wireless vital signs monitor, where you can have a resident who you can either set them up, or if they're independent, again, I keep pointing out some of our residents, seniors, still have independencies that they are able to manage themselves. Being able to encourage and support that, where they can monitor that, they can check their blood glucose, and that the result, again, wirelessly gets uploaded into an electronic health record system. And then ultimately having that electronic health record system being part of a larger ecosystem, so that there are still opportunities for transition in care. Because I think, yes, we look at things from a residential care setting right now, but the goal really is to make sure that people can get care in the right setting. And it might not always be a residential care setting. As we know, we have a huge backlog now in terms of available beds. So those who are still waiting for a bed or placement in a long-term care home, there can be some sort of support that they get in, that we will actually then be able to have access to that information once they move into a residential care setting environment. I think it's just those kind of things. And then ultimately being able to factor in design and future planning with our quality of life indicators, our clinical indicators, looking at the incidence of pressure ulcers, falls, use of antipsychotics, being able to use that to design what care would look like in the future, getting that quality of life indicators for residents. What matters to me? What time do I like to go to bed? Food choices, social engagement, being able to make friends. So those kind of things, again, is just maybe using that data to further design how we build residential care settings later in the future, how we design what a day-to-day would look like, how we even influence compliance when it comes to the regulations that guide what we do in long-term care. There are a ton of possibilities out there with technology. I would just love to see that we can look at it from the two perspectives of the care provider and also from seniors themselves.
Thank you, Mide. I wonder, Keren, if you could perhaps build on bringing people together and, cross-functional systems, people who are providing and people who are designing. And we're seeing so much more of industry teams, partners coming together to look at common problems. How do you do that? How do you bring some of this cross-functional systems and teams together to achieve innovation and to achieve results?
This is a great question. I think one of the wonderful things that we see come up over the past few years is more and more innovation teams or innovation directors within the senior living industry, within the elder care industry in general. And I think obviously one of the organizations that has been doing particularly well at promoting these cross-sector collaborations is CABHI. And the way that smaller organizations do it is, again, to have a person on the team who is an director of innovation, or multiple people who lead innovation, and their job is basically to source innovation for whatever challenges their particular organization faces. And the wonderful thing is that then they then get to pilot such technologies within the organizations and really bring together all the different stakeholders. So bringing older adults to give feedback to the founders and product people who are building the innovation, bringing anyone from the direct care workers to the CFO, whoever within the organization is impacted or should have a saying about this type of technology. And these partnerships, which are usually called design partnerships, are really such an invaluable resource for startups, because you can't build alone in your basement. You have to include all of the different stakeholders in the design process. And having these partnerships really helps push our ecosystem forward. And of course, having all of the different programs that CABHI offers that facilitate these types of partnerships are really the kind of stuff that really pushes the ecosystem forward. And I think that there has been a mind shift recently. And I think everyone who works in elder care these days understands that we not just have to bring technology into elder care, but also that we have to include all the different stakeholders in the process. And I think that more and more organizations these days are actively pursuing technology and pursuing innovation. I think that is a really positive change going forward.
Thank you. Yasuko, anything to add about that piece? And perhaps you mentioned before around the lived experience and the value of the lived experience. Any sort of insights on how to make sure that multiple perspectives are heard in your innovation efforts, and how do we ensure that everyone's ideas help to move forward to see the light of day?
In Japan, we have the stereotype caregivers and elder people not using technology. So every industry is just only their market. Japan is a super aging society, but to be honest, it is behind of the implemented technology. So the reason why I joined this discussion, and I'm the reason why I become the aging 2.0 ambassador, is to promote technology can change the big issues of super aging society Japan, changing the thoughts, changing the mind. Many foreigners think so. Japanese technology is advanced because we have a lot of robotics and many kind of robotics we have, but these robotics are just a proof of concept. They don't have the market. Last time when I visited CABHI, so I'll talk with Allison about why do you make the leap, and I would like to implement the leap concept into Japan.
Excellent. Lots of different ideas and programs that we can learn from each other, and different communities like LEAP that we can join and learn from the lived experience of people who are actually aging and those who are invested in the market to promote the use of technology as solutions. We are slowly coming to the end of our panel, and I wonder that if you were to each think about the future, and if we were back here in 5 or 10 years, what's your prediction about what we're going to be talking about then? What's going to be the most important trend, or perhaps what will we have really achieved, and what will we be talking about 5 to 10 years from now? What will industry disruption look like? Mide, do you want to start us off on that?
Certainly. Thank you very much, Faith. 5 to 10 years from now sounds like a long time, but not really much of a long time, actually. But I think what would be ideal would be that the seniors care environment becomes or has a better reputation. And when I say better reputation, I think in terms of the younger generation, they want to actually be involved. That's what we would like to see 5 to 10 years from now. They are actually bringing some of the current technologies that they're using, bringing it into this space to help us to improve this space. Something as simple as the way they use social media right now for engagement and communication. Maybe this is something that gets, factored into how we develop care plans. Again, it sounds ridiculous sometimes, but maybe it's doing TikTok challenges for seniors as a way to promote exercise. It's looking at some of the things that already exist, because I think, again, 5 to 10 years from now, it's not that far off. And I think ideally it'll be where we can see the generational switch that's happening. And I think, Yasuko, you mentioned the baby boomer generation. We in this sector are already thinking about them and their children, because when you look at providing cares to the baby boomer generation, a lot of them will have some input from their children as well, which would be the next generation. So it'll also be starting to think about what does that look like. And I think at that point will be more of us balancing that generational switch. What's important to the baby boomer generation might not be the same as to the millennials and Generation X, right? So it's at that point in time, I feel like we will be advanced with technology in terms of using that to supplement care. But at that point, it's just trying to now move a shift towards what's more important for the next generations. And I think ultimately would really be just being able to adopt different models of care. Again, I speak to something like possibilities model, which also has a good and nice balanced focus on the use of technology. So I think 5 to 10 years from now, that will be the norm. We will just be fine tuning how we are able to implement them in different environments. Also keeping in mind, though, that majority of these environments still have some sort of legislative or compliance requirements in place. And I think at 5 to 10 years from now, again, that line would not be filled with too much red tape. We will be able to better integrate. We'll be able to build a better ecosystem, transformation, the ease of flow of information, because that's one of the biggest issues right now, flow of information between someone living independently to home and community care, acute care settings in a hospital, and then in a place like a long-term care or palliative care or hospice. So I think that lastly will be for me is looking at that ease of flow of information as well will be at our fingertips 5 to 10 years from now. We won't be struggling and fighting each other to get useful information to provide better care.
Excellent, Mide. Yasuko, what's your big, bold prediction on the most important trends and progress 5 to 10 years from now?
After 10 years ago, I will be 75 years old. I want to stay at home. And now I am putting some sensors, many sensors connected, and assisted atmosphere living. It will be successful in 10 years. So I hope. I bought a robot, and this year I make some sensor equipment for myself in the future, for my future.
That is phenomenal. So you will be surrounded by robots in your own home,
yeah.
which is amazing. And finally, Keren, what about you? What do you think? What do you think we'll be talking about in 5 to 10 years? Where do you see yourself going?
So first of all, I have to say that I completely agree with Mide and with Yasuko. What I want to see 5 to 10 years into the future is distribution for healthtech products becoming easier. Because I think the main challenge, if I look at it from the ecosystem perspective, the main challenge healthtech startups face today is not fundraising, although that's hard, and it's not product development because the technological challenges are far from insurmountable these days, but it's distribution. And I want to see, first of all, every older adult in the world aware that there are technological solutions. And I want every caregiver to know that there are technological solutions. And what I think should happen is that every organization that provides elder care should have a distribution or an acquisition process, a procurement process for age tech solutions. And every healthcare provider should cover technology as benefits, and every insurance provider should cover technology as benefits. And the government also has to cover these solutions, because unfortunately, technology can be expensive and it's not affordable for everyone. So I think that in order to get this technological revolution, the age tech revolution, accessible to each and every older adult globally, we have to have proper distribution channels, and it's going to take a village. So every stakeholder is in this ecosystem will have to pull its weight and do the best they can to really make technology accessible for older adults and for people who care for them.
Exciting to think about an age tech revolution where we would have access to all of that in our homes for ourselves and for our communities and also for society. So I want to thank each of our panel members for participating today and sharing their insights and experiences and for daring to make change. Thank you for that. I also want to thank CABHI and the teams who helped to make today possible, and of course our event sponsors for enabling this important event to take place. And finally, I want to thank you, our audience, for taking the time to attend our panel, and this one in particular today. I wish you all a wonderful day. Thanks very much.
Thank you for joining us for this special episode of the Community of Innovation podcast. We also want to thank our podcast production team, including Monique Chang, Nicole Pacampera, and our friends over at Podtex.
To learn more about CABHI, please visit us at cabhi.com. That's CABHI.com. We'd also love your support of our podcast, so please be sure to slam that subscribe button and leave a review on YouTube, SoundCloud, Spotify, Apple Podcasts, or wherever you get your pods.